Hi everyone, Sean Hackett here. I'm just going to do a quick discussion about entrustable activities and competencies. Might help you with the work that you're doing at this stage. Recognize that this is evolving work. It's being heavily researched. It's being used in many facets of the medical community, particularly here in Canada. There's a lot of growing pains with this right now, and we're still learning. I work at Orange Medical Transport, the critical care patient transport provider in Ontario, and we have been looking into this topic and organizing ourselves with entrustable activities and competencies for almost 3 years now. And we're still learning. We don't have it perfect. Our work is still just beginning, but we are going to share with you what we've done so far so that we can be talking the same language and learn together. Just to simplify this, anecdotally, we'll use hockey. We're in Canada, so it seems suitable that we can put this in terms that most of us can understand. So I like the Canadian women's hockey team. I think they're highly competent hockey players. So let's talk about that in terms of their professional activities and their competence.
Haley Irwin knocks it down along the boards. She's been terrific along
Haley
the boards.
Irwin knocks it
Centering
down
pass
along
in
the
front.
boards.
They
She's
score.
been terrific along the boards.
Poulet
The
has
centering
tied
pass
it
in
for Canada.
Canada.
They score. Poulet has tied it for Canada.
Just the battles along the boards. Rebecca Johnson just
Haley Irwin knocks it down along the boards. She's been terrific along the boards. A centering pass in front.
Okay, so we saw quickly there. A couple of things happened. We had a player up against the boards, looked around, made a pass, and then Poulin came in and took the puck, made a little move, and scored a goal. So that is their profession, hockey. So how do you talk about hockey in terms of professional activities and competence? An activity in any profession requires the integration of knowledge, skills, and attitudes. And you might recognize learning objectives from Bloom's taxonomy as cognitive, psychomotor, and affective. In this instance, we have a hockey player who knows the rules, knows how to tie their skates, knows what stick to use, knows their team plays, and you can go to higher level cognitive functions too, where they're recognizing the other team strategy. They have psychomotor abilities. They have the ability to skate, stick handle, the ability to shoot, things that they might practice over and over and over again to get better psychomotor hand-eye coordination at, as well as on defense, blocking shots. And then you have the affective, which is valuing or prioritizing when things are important. So where would you be on the ice? Where do you position yourself? What direction are you skating in? When do you switch to defense? When do you switch to offense? When do you pass? When do you shoot? These are all decision-making functions that you are prioritizing, that you're valuing when these things are important. So the observable activity is the integration of these things. You put this thing together where you know where to be on the ice. You know how to take a pass. You're practiced and you have that muscle memory to take the pass, and you value now's the time to take a shot, and you use your ability to take a shot. And so the observable action is that play of taking the shot. Or you could even break it down and say scoring a goal. And then the entrustment piece, the entrustable activity. Entrustment is something that's given. So in this case, you could look at it from the perspective of the coach. So the entrustment from the coach is saying, give Poulin the puck. The coach is entrusting Poulin is the person to take that shot. Poulin earned that entrustable professional activity of shooting on the net by being proficient, by practicing, by demonstrating competence repeatedly in important situations. integrating all those abilities, knowledge, attitudes, and skills together in a proficient manner has demonstrated that Poulin deserves the right to have the puck in a clutch moment. So competence then is how well a thing is done. Competency in medicine can be somewhat convoluted and complicated, but let's talk about it in terms of a measure of how well you do a professional attribute. So think about Captain Clutch, Poulin, as a competent forward, a competent captain, a competent representative of Canada. And then you put that in terms of paramedicine. You think, well, paramedic could be a competent clinician, a competent driver, a competent administrator, as some paramedics go into management and logistics and other avenues. You can get more specific, and how specific you get with this is dependent on your needs. What do you need to describe and what do you need to communicate to each other, to the medical community, to patients, and to students? It's all about understanding what it is you're communicating. So you can say a paramedic is a competent communicator. They're a competent medication administrator. They're a competent mechanical ventilator. They're competent at treating acute coronary syndromes. They're competent at transporting patients. These are things that can define a paramedic. But those things are a little bit broad. They're not very specific, like an activity. They're more of like a forward in hockey or a captain of a hockey team versus shooting the puck is the activity that you saw the hockey player do. So when you put it in those terms, the things that you observe and assess, the things that you see the paramedic do, those are the activities, those are the actions. So an action that is taken is activity, and it could be an entrustable activity. How effectively they do those things together would be competency. So to make it a professional activity, there are rules from the Equal Criteria by Ole Tenkate, and there's 14 criteria, but to really break it down, the core of it is this something that requires a paramedic? You're not calling a plumber to do this intubation. You're not calling a lawyer to transport this patient. You're calling a paramedic for that. Is it an observable action with a beginning and end? So administering epinephrine intramuscular is something that you would see them do from beginning to end. Does it require the integration of knowledge, skills, and attitudes? A straightforward intramuscular injection is really just a skill, like shooting the puck, right? You can shoot the puck at the net over and over and over again. But knowing where to be on the ice and take the pass and judging when to shoot, where to shoot, that's the integration of that shooting the puck activity. And so in the same way, paramedics have that activity of, I'm going to choose epinephrine for anaphylaxis. I'm going to choose the dosage that's appropriate for my patient. I'm going to choose the route of administration being intramuscular in this case. I'm going to choose what needle size I'm going to use. I'm going to choose how I'm drawing that up. I'm going to choose to show my partner what I've done and confirm my medications. And then I'm going to do the actual skill part of it, which is administering the drug. But that administration of epinephrine is really the activity that you're looking at. You could even broaden it and say the treatment of anaphylaxis. But treatment of anaphylaxis is very broad and could include prevention. It could include post-care. It could include a lot of things. It could be very broad. And while you could observe that from beginning to end, it gets very convoluted. So again, this is what your needs are. So how narrow you make that is based on your needs. So saying specifically intramuscular treatment of anaphylaxis with epinephrine is a professional activity that you're calling a paramedic for. It's observable, has a beginning and end, and that I can say I know how well you did that. I observed you, and I can judge you on how well you did that, and I can give you feedback on that so you can improve for the next time. And then the entrustment part is really, would you just let anybody do this? Or do you trust them to do it? And if you trust them to do it, that's the entrustment of the activity. What's important in all of this is that we need to communicate what we're seeing and what we're giving feedback on. We need to communicate what our expectations are. So when I say treatment of anaphylaxis, am I including prevention and am I including post-care? I have to describe that in the activity, or am I just describing administration of epinephrine intramuscularly? And is that what I'm saying is the entrustment? And is this something that's achievable and reproducible so that we can communicate that to each other in different institutions or different geographies or from learner to student? Most important of all in all of this is that patients are getting the right care. This is about patients getting the right care. So when you're looking at this whole discussion around activities and competencies, what you're really trying to do is you're just trying to clarify communication to give people feedback to say, this is how we can do it better. And that's how we all get better. And that's about patients getting the right care. So like I said before, this is research in progress for us. We don't have it perfect. We're still learning ourselves. And so if anything I've said you don't think is right or doesn't jive, reach out to me. We can have that conversation. I am absolutely willing to learn more about this. I think it's important for our profession. Thank you.